I remember my freshman year, I had no idea what adderall was. And then slowly but surely, everyone kept on asking, especially around big testing time.
My first experience with it was first semester freshman year. I took it and initially didn't like it.
My first year on campus, oh, do you guys have Adderall? Does anyone have Adderall? You know, people were asking around what Adderall is and what is it? And I remember the first response I ever heard was, it makes you get good grades, or it makes you concentrate.
It definitely found me freshman year.
It wasn't till sophomore year that I really started to use it kind of on a more often basis, I guess.
I mean, I wasn't trying to fail out, you know, like coming to college from Africa was a huge milestone for me. And so it was like whatever I could do to make sure I didn't like fail any of my classes.
A lot of people get prescribed regardless of whether or not they are ADHD or ADD.
And it's pretty easy to find on campus, actually.
I don't think it's that hard to get.
Equivalent to me getting some groceries, or equivalent to me going to the corner store to picking up some beer. I would assume it would take me less than 15 to 20 minutes.
I can make one phone call.
Why ban something that's in a lot of ways helping kids through college?
I feel like it's not really going to affect their health or anything like that, so I don't think it's that big of a deal.
Sometimes people just procrastinate, and you know, when you have to study, and sometimes you wake up and you know, oh, I have to study, otherwise I'm going to fail this test, and you're not in the mood. Whatever it is, people take Adderall for that time. That's why people call it
steroids for your brain. Yeah.
A growing problem across the United States, especially on college campuses, is the overuse of specific prescription stimulants, such as Adderall and Ritalin. The question is, why are these drugs so prevalent amongst college, and what effects causes the popularity? These drugs are generally prescribed for the treatment of attention deficit hyperactivity disorder, or ADHD. ADHD inhibits a person's ability to pay attention as hyperactive. ADHD is the malfunction of the frontal cortex, which is involved with the functions of focusing, problem solving, and reasoning. Dopamine is an important neurotransmitter within the frontal cortex, and when concentrations are unbalanced, the functions of the frontal cortex are handicapped. This disease is becoming more popular as a diagnosis for unable to concentrate. Drugs used as treatment, Adderall and Ritalin, are being used recreationally amongst college students, almost 10%, to help with academics. The overuse of Adderall and other prescription stimulants on college campuses can be examined by how the drug works, who it affects, and why they have become so popular. According to many studies, college students are the main abusers for the prescription stimulants. In a study, 10,904 undergraduate college students were surveyed. The study found that approximately 8.7% of college students have used prescription stimulants in a non-medical way. There was a great deal of variation within different genders, races, and other factors. The most prevalent group on a college campus using these prescriptions is a white male who lives in a fraternity house with a B or lower grade point average. There is also a strong correlation between the alleged use of Adderall and other forms of drugs and risky behaviors. A finding from the study states that past year non-medical prescription stimulant users were 10 times more likely to report marijuana use in the past year, almost 7 times more likely to report frequent binge drinking, over 20 times more likely to report cocaine use in the past year, and other 5 times more likely to report driving after binge drinking than college students who had not used prescription stimulants non-medically. Adderall was the most prevalent form of illicit prescription stimulants on a college campus due to the availability and minimal side effects. The drug has a low occurrence of ups and downs, unlike other drugs of the same nature. When taking Adderall, it lasts in your system for about 10 to 12 hours, comparable to only 6 on the other drugs. All of these drugs increase the brain functions and concentration. They increase dopamine levels within the brain and block the dopamine transporter. Adderall takes it a step further, however, and generates a higher level of dopamine and stays higher longer. This improves the cognitive functioning, or attention is also increased. Adderall user states that the ability to stay on task, even the dullest, most numbing task, was Adderall's first gift to me. Just like every other drug, there is side effects. Side effects of this drug are minimal for ADHD diagnosed patients, but if not diagnosed, the side effects increase. The risk for dependence and addiction arises if using the drug to get through the week. Other side effects are being irritable and a decrease in creativity. Purdue freshman Danny states that when you first take it, you are in such a good mood. You feel like you can accomplish anything in the world, but then a couple hours later, you get a bit cranky. Other side effects include a sacrifice of creativities. Studies have been conducted to decide whether or not this trade-off from creativity and Adderall really happened. A study conducted 4 tests. 3 of them concluded that the drug had no effect on the creative side of the brain, and the 4th concluded that the drug increased creativity. There is no evidence of impairment of creative measures. Even though there are side effects present, for most people, the benefits outweigh the possible side effects. They're similar within every user of these drugs. Increased concentration leads to better academic performance. Academic environment is also an increasing factor. With a high level of competitiveness within the academic spectrum would increase the chances of a student to use the drug. College environments and the convenience of the drugs contribute to the popularity. Students who suffer from this disease get approached from other students to share their medication. One study showing about 54% that were prescribed were asked. Most individuals within college are adults and do not have supervision of their medication. This makes it easier for students to sell or give away their medications than secondary and elementary schools. 65.2% of legit prescription users started in college. Most users state that they use the drugs not to get high or for recreational purposes, but to help with concentration, help study, and to increase alertness. The monitoring of the future study found that college students reported a higher rate of non-medical use of Ritalin and other drugs of this sort than the same peers that are not attending college. This fact alone shows the prevalence across college campuses, which poses the question why. Many believe that the academic pressure and strive for perfection are the 2 main causes. Because of the stress and workload that comes with college, this makes many students turn towards the easy way out and take stimulant drugs. In conclusion, the use of Adderall and other prescription drugs are overused across college campuses by students for a variety of reasons. College stress and high academic standards, easy accessibility, and an increased concentration from the pill all contribute to why these drugs are so popular for this age group.